Welcome to the SSI Orbit podcast, a forum where we explore the ever-growing ecosystems of self-sovereign identity. And I'm your host, Mathieu Glaude. In today's conversation, I welcome Jim St-Clair, the Chief Trust Officer for the Lumedic Exchange, the first internationally available patient-centric data exchange platform. Now, Jim leads the development and harmonization of W3C verifiable credential data standards across healthcare and identity use cases. And during this conversation, we discussed Jim's vast experience and expertise in healthcare IT and today's leading standards that healthcare operators must follow when dealing with patient health data. We discussed the patient era, which is the next evolution of healthcare, and how the work happening at the Lumedic Exchange is enabling all of this. So the Lumedic Exchange is exciting as this is an open ecosystem for collaboration around patient-centric health advancements, and they're working on developing trust frameworks for this decentralized model and much more through various working groups. We also touch upon Lumedic Connect, the toolkits that they've built to enable these processes to use verifiable credentials. Now, without further ado, here's my conversation with Jim St-Clair. Okay, we're on. Hi, Jim. How's it going?
I'm well, sir. How are you today?
I'm doing pretty well. So what I wanted to do is just start off this conversation before getting into all of the cool stuff that you're doing at Lumedic and through the different communities that you're working in, just to take a little bit of a step back and to understand how you got into healthcare. It doesn't seem like it's you got into it just yesterday. So do you mind giving kind of a background of how you got into the healthcare space?
Sure, absolutely. And I want to be clear that I characterize my health involvement and healthcare involvement around health IT. I don't have the privilege of being in healthcare like many frontline workers and doctors and nurses, but have come into it as a technologist going back about really about 12 years ago, I guess. I've been in technology and the public sector for a little over 20 years. And during my time in the public sector and public sector consulting in Washington, D.C., I got more involved with federal agencies in healthcare and federal health IT and data efforts. I used that opportunity actually to go to work for HIMSS, the Health Information and Management Systems Society, which is the world's largest cause-based nonprofit specifically focused on healthcare technology and the use of technology for patient empowerment and patient engagement. I spent a year and a half with them as the Senior Director for Interoperability and Standards. Left that job to go back into public sector consulting, supporting the state of Vermont with implementing some systems as part of the Affordable Care Act. Then moved into another small company supporting a large enterprise software development initiative with the Department of Veterans Affairs, the VA, and then worked for another small company in Maryland with a focus on Center for Medicare and Medicaid Services, which is part of US HHS. Stayed involved with HL7 and several other standards groups and consortia, and then started working with Lumedic in January of this year, specifically focused both on digital identity standards, especially in self-sovereign identity, and also continuing to work in HL7. Lumedic is part of the Providence Health Systems, and we play a very active role in several HL7 initiatives for health IT and data exchange. And it's very complementary to the work we're also doing with groups like Sovereign and Trust Over IP Foundation, et cetera.
For those who aren't familiar with HL7, like myself, what is it?
Sure. I didn't mean to just throw that out there, but HL7 is an international body. HL stands for Health Level 7. And I apologize for not remembering exactly when they got started, but they've been around for several decades. And they have various international working groups and focus areas that are using standard schemas very similar to like W3C and others to develop health data standards for interoperable health data in healthcare systems.
Got it. And then there are other organizations as well. I think the FHIR, like the Fast Healthcare Interoperability Resource, is another one that you're a part of, or at least when you were part of HIMSS was a part of that too?
Oh, I'm glad you mentioned that. So FHIR, Fast Health Information Resources, is in fact the latest JSON-based iteration of technology that HL7 has developed over about the last 6 or 7 years. So the development of health standards has been iterative, and I'm sure, just like Matthew, going back to the data standards and the way data was organized and used in the client server environment has changed with web services and with APIs and cloud services and the internet, et cetera, et cetera. And health data standards have changed as well. And so FHIR, Fast Health Information Resources, is the latest iteration for being able to capture health data from electronic healthcare records and make it available through web services.
Got it. Thanks for the breakdown.
Sure.
There's a newer kind of act a little more recently, but I'll just take a step back before getting to there. There was a nice kind of representation that Michael Nash from your team put together, kind of just showing the progress of healthcare, like as it started in its pre-digital era. You started to get different standards and legislations like HIPAA that came around. Then you started to get more and more digital standards and high-tech standards as kind of the paper era moved into the digital era. And then today, closer to today, with the 21st Century Cures Act kind of coming into place, moving kind of from the digital era towards more the patient era. How have you viewed that whole evolution in healthcare, and how has kind of the 21st Century Cures Act kind of aligned with what you guys are doing or what you're thinking?
Absolutely. And I think your description was outstanding. Mike Nash, as our CEO, has espoused this vision, which I think is outstanding about the healthcare in the U.S. coming into the patient era, and how Lumedic is part of the patient era now. And to walk through that evolution just a bit more that you just articulated. Just like so many other industries, we moved from paper to digital over the course of the last couple decades. And in healthcare, there was a change in regulatory focus to take into account the fact that that healthcare records, which had historically been, big, thick binders of paper and faxes and notes, which still persist today, have been more and more transitioning into the world of digital and digital records, electronic healthcare record systems. And that prompted a law in 1996 called the Health Information Portability and Accountability Act, which was groundbreaking in its obviousness in saying that, number one, your healthcare data should be able to go wherever you want it to go. And that, number two, healthcare systems were responsible for how they manage, safeguard, and distribute electronic health information, which we called EHI or PHI, Protected Health Information. And while, number one, everyone appreciates the fact that the law helped clarify and articulate that data should be available to you wherever you need it to be, and that it could be transferable, and most importantly, there were protections behind it. It still had kind of an organizational silo feel to it, and that traditional client server type view. But of course, since that time in 1996, obviously more and more things are available through the internet and mobile apps and electronic systems. And then you have various, middleware and patient engagement experience platforms, and use of third-party apps and health and fitness apps. And so, if anything, I think the term I use now is ubiquitousness of healthcare data. That your healthcare data should be ubiquitous in terms of your ability to get it, combine it with other information that you're collecting, and it should be ubiquitous in its presentation and ability to be used at different places. And that's where we're getting into with the patient era, which is you as the patient have the technology, and we have the architectures to empower you to be able to collect your data and use it as you see fit. Your ability to get access to that data and be able to use that data as you see fit has oftentimes been, questionable just because of healthcare silos. But we're now at a point where the architecture and the technology no longer restricts that sort of silo of data, and that you should be able to take advantage of it and use apps to do so. And that is a thematic undercurrent to everything that we do with Lumedic, but in particular around the Lumedic Connect identity platform.
So then something like HIPAA, which I don't know the exact date. I would say kind of in the 90s came around. That might have been
1996. Yes, sir.
So that was the exact date you were just referring to. So the HIPAA, which provides guidance for, I guess, health information exchange between organizations, that is still valid with the 21st Century Cures Act. It would be a piece that just fits within that act. It's just the act makes it more possible for more patient-driven or patient-owned models.
Yeah, that's a great point. So the 21st Century Cures Act, as suggested, passed here in the 21st century, go into effect in 2021, does in many ways kind of layer on top of HIPAA. And I think you bring up a good point that's worth clarifying. HIPAA was passed in 1996, and apologize why I suddenly draw a blank, but in 2010, you had HITECH, the Health Information Technology for Economy and Community Health. I think it was HITECH. HITECH added another layer to HIPAA in terms of recognizing health information and promoting the use of electronic healthcare records. And now you have the 21st Century Cures Act, of which there's many good summaries out there that your listeners can find for the 21st Century Cures Act. But the most important thing is how it takes such a broader message and regulatory guideline around the availability of health information, something called patient access APIs, and subsequent modification to things like the HIPAA privacy rule and others that help bolster the underlying message that patients should access their own information.
Got it. So if we look at kind of a patient-centric ID or the patient era moving forward, why is that the solution to fix the problems? I'm assuming there's a lot of problems that are related to, and you've described a few of them, just kind of the siloed view of data and the lack of interoperability and stuff like that. What are the major benefits of patient ID that you guys are excited about?
Yeah, so I'd say that there's a couple things, and on its surface, one can be excited about just the principles of privacy preserving architectures and building in the concepts of self-sovereign identity, the sort of things that obviously you and I and other folks in the identity standards world are excited about, to allow people to control their own information and help control how their information is shared. But even more so than that, if the information is controlled by the individual and by the patient, they're now empowered to control where that information goes. I oftentimes make an analogy that culturally, healthcare in some ways is still like the going to see the tribal shaman 10,000 years ago. I show up at a healthcare environment. Some doctor says that there's some issue. Maybe I understand it, maybe I don't, which is a patient health literacy issue. Maybe I have access to the data. Maybe he or she magically presents a lab result and says, hey, this is the issue, and now you have to go and do this, this, and this, and these are 3 other things that you're being told to do. That changes when you now have the individual being able to manage how their data is collected and how their data is disseminated, how they do things in the healthcare environment with a healthcare organization. And I think it now allows them to be empowered to make decisions about, well, I'm not just going to see this doctor here, I'm also going to see this doctor here. Or when I do see this doctor, these are the things that I think they need to know about me. But I shouldn't have to consent to share my entire life history with them if I don't feel it's relevant. If I'm going to a back specialist, do they need to know something about substance abuse that may or may not have anything to do with that? And how do I, as a patient, get more involved with how my health information moves around in a way that I've never been involved before, whether it was paper or digital?
Is another interesting aspect to that. Like, you definitely have the privacy preserving aspects to the whole story here, but I think we're seeing in healthcare and just like health technology and stuff like that. Like you're as a person, like we're getting more and more opportunities to use different methods for health data inputs, whether it's just wearables, whether it's going to different specialized treatments or scans or stuff like that. So I guess being kind of at the center and having control of that and being able to amalgamate that yourself at the center kind of goes along the whole big data story, where there's actually tons of opportunities to use more and more data in healthcare today. It's probably another benefit of having this patient-centric model.
That's a wonderful analogy, and I'd add to it as well. I'm sure you've read quite a bit about the use of AI in healthcare and AI services and chatbots and that sort of thing. The more that you have the ability to collect your own information and use that in support of tools like an AI-driven application, for instance, the more that things can be customized to you or built on what we call evidence-based medicine, EBM, as a framework for decision making. So with the proliferation of health apps and the advancement in technologies that allow you to monitor your own heart rate at home, assist you with medication adherence and how you take medication, and gathering that information in your own app, having that information available to you as part of your own data, as part of clinical decision making and deciding where your data goes and what you do, is really where the 21st century is going. So, again, the 21st Century Cures Act is your ability to get that information, work with information from mobile apps and health applications, and then decide how that information is shared and control the consent that belongs to you.
Got it. So
yeah.
Lumedic is an organization. We've been hearing more about the stuff you're doing through different communities like the Trust Over IP. Lumedic is an organization that was existing but was purchased by Providence Health Systems a few years ago. Do you mind just kind of making the distinction between those two organizations and what both of them are kind of up to?
Sure, absolutely. So Providence Health Systems is the 9th largest healthcare system in the U.S., and they are a non-for-profit Catholic hospital system located in Seattle, and they support 7 states. Under that, or as part of Providence Health Systems, they have a for-profit portfolio of companies called Tegria, and one of the companies under that Tegria portfolio is Lumedic. And as you mentioned, Lumedic was acquired independently a couple years ago to be added to that portfolio to support new kind of tech startups and health innovations within that portfolio under the umbrella of a large major healthcare system. And then just to add on top of that, Providence has its own digital innovation group and coordinate with a venture fund, and it kind of gives them a broad base of involvement for identifying healthcare technology solutions that obviously advance their mission for care delivery in the states that they support.
And then within Lumedic, you have the opportunity to hopefully leverage the ecosystem of different companies that or different resources that Providence has assembled or Tegria has under their portfolio.
Yeah, and that's a great point too, and one I'm not afraid to advertise, which is, there's lots and lots of health tech companies out there, as I'm sure you're aware of. Very few of them have the opportunity to participate in daily and interact directly with a healthcare system beyond just a traditional kind of customer-vendor relationship. And not only that, but a healthcare system of the size and scope of Providence. So I consider myself very fortunate that I get to work alongside senior Providence healthcare professionals and leaders as part of what we're doing and advancing. Specifically, as an example, we've created the Lumedic Exchange, which is a voluntary organization of stakeholders from other healthcare organizations, but including Providence, whose focus is on developing use cases and workflows around this concept of verifiable credentials. And that gives us the opportunity to tap into not only just folks that are technically part of Providence Health Systems, but Providence itself has Providence of Oregon. It's got other systems in California. It gives a tremendous degree of variety and organizational diversity each representing different healthcare organization perspectives as part of this development work. So there are very few health tech companies that can offer that sort of background and diversity in terms of their solution development and application.
What was the vision behind the Lumedic Exchange? Like, it made sense to have some sort of ecosystem or consortium, as you could call it, maybe just governing the health apps or the data or the different systems and what people are using. Is that kind of the idea behind the Lumedic Exchange?
Yeah, that's a great question. And I know we haven't talked about it too much besides just the references to the Trust Over IP Foundation. But the Lumedic Connect product is based entirely on the Trust Over IP Foundation sort of framework for managing decentralized identity and using the W3C World Wide Web Consortium verifiable credential model. And if you think about what that verifiable credential trust triangle model looks like between the issuer, the credential holder, and the credential verifier, what type of business processes and use cases are there for using that verifiable credential in healthcare use cases? And despite what we could bring to the table for technical knowledge and engineering to develop the Lumedic Connect product, as a small company or even just in conjunction with Providence Health, we couldn't necessarily come up with every use case by ourselves or get industry buy-in for a use case for how a verifiable credential could be used in a healthcare scenario without participation of as many healthcare organizations as possible. And so we've created the Lumedic Exchange to allow healthcare organizations to join for free and participate in that process to get educated about verifiable credentials and contribute their perspective as to, if I have a patient coming in for an x-ray and they have their insurance through Blue Cross Blue Shield, what needs to go into a verifiable credential? What's the registration process like? How do I tie that credential to the imaging system and to the image? How does it work with their insurance eligibility and registration, that sort of thing?
Super cool. And are you seeing, I always worry about the education gap with any new technologies, but is it clicking like with the health providers that are coming into the Lumedic Exchange, are they really seeing the value of portable digital verifiable credentials?
That's a great question. I would like to say that they're seeing the value of it, but it is a brand new effort. We really launched about November of last year, which of course, launching anything last year in the pandemic, I think obviously complicates some of your messaging. But what I can say is we have strong participation from several folks in the payer community, from MasterCard, Identity Services, from other representatives in Providence, from Higher Right, the human resources information company, and they are consistently participating in both a couple of the work groups we've stood up, plus some new ones that are addressing various issues for credentials. So I'm only optimistic that the momentum is going to build this year, and I think both membership, contributions, and value will all be built as the year goes on.
It seems like the one opportunity, or the one of the good things with COVID, if there's any of them, is just driving kind of the push towards more and more digitization. So the use of proof of vaccines, that's one of the first use cases that seems like you're focused on.
Yes, and I like the way you kind of paraphrase that. Both fortunately and unfortunately, it's terribly unfortunate that we have such a human toll and tragedy concerning the pandemic. On the other hand, it has prompted consideration and forced changes in business models and ways that we've, in some cases just talked about and never been able to do, that are now reality, whether it's telework and now adoption of telehealth and virtual care, and just moving that forward. And in many ways, the substance around a health pass or vaccination credential was there before, and it's something we've been working on as an underlying technology with Lumedic Connect and for Providence for a couple of years. But, fortunately or unfortunately, the foundation of vaccination coverage and a vaccination credential serves as a foundation for really demonstrating a use case in one of the most positive and fast-moving ways. So,
yeah, but people definitely understand that when they see it, and it has been interesting. I remember, I guess, early last year when we were in the early days of COVID, with the COVID credentials initiative starting and a lot of different efforts kind of trying to look at a way to use these new technologies for good without sacrificing privacy, without sacrificing any ethical considerations and so forth. What, like, although this stuff could excite you, is there stuff that scares you about the COVID? There seems to be a lot of different COVID projects as well that are going on right now, right?
Absolutely. And of course, I'll be quick to point out ours as being one of the best, but I do so in the context that, the vaccination credential use case is but one of many use cases that we're looking at as part of this broader aspect of managing patient health information that we've been talking about so far. And that you had clearly called out with things like HIPAA and the 21st Century Cures Act. But you're right. Unfortunately, there's several prominent cases going on right now, or several prominent industry applications where privacy seems like a real concern. And it's understandably very difficult for a consumer to look at these different things and be told, oh, don't worry, it's on the blockchain, and that's somehow supposed to mean something in terms of privacy, without underlying what a governance framework is, what an inherent privacy preserving sort of architecture is. And we were aiming for all of that first and foremost, even before just dealing with vaccination credentials. And so that's built on it too. So in working with things like the Good Health Pass Collaborative, we're trying to come up with that good housekeeping UL type seal of approval that shows this credential application and mobile application has taken into account key considerations for privacy, security, interoperability, a trust framework, et cetera, so that you can trust and appreciate that these apps are only working your behalf, and that they're not representing either some corporate surveillance of healthcare or some other government intrusion into your health information.
Are the kind of trust models or trust frameworks that you've been working on within the Lumedic Exchange, and there's a lot of good work happening, as you mentioned, at the Good Health Pass Collaborative, is there a lot of overlap there? Have you been able to contribute to that?
I appreciate that. I'll leave it to my peers to determine if I'm actually making a contribution or not, but I show up for all the meetings for sure. But I think you make a great point. It's entirely collaborative. And if you think about it, in some respects, again, the things that we're working through in terms of privacy and interoperability and trust frameworks in the Good Health Pass Collaborative, while called into focus around the issue of vaccination credentials, also pertain across the board with any other healthcare information type factor. So, as you mentioned, there's lots of good companies in CCI and lots of work there. But of course, as an organization, they're focused on COVID credentials. Ours is a focus on health information credentials, patient-centric identity management first, with COVID credentials being a natural overlay to that.
Yeah, and then there's the need for trust models or trust frameworks across different industries or ecosystems. Like we see a lot of stuff happening in the financial sector, which is the area which we do a little more. But how do you describe a trust model or trust framework to someone? Because that's it's kind of a new concept, right? That wasn't necessarily there with traditional architected systems.
Yeah, that's a great question, and you're right. It is very new. When you're advancing this model of trust first and foremost. And speaking as a chief trust officer, I, of course, spend some time explaining, well, what is a chief trust officer? And I emphasize to them around how, previous roles for chief this and chief that, whether it was a chief information officer, chief technology officer, chief data officer, all highlighted how organizations were taking a new organizational leadership around that particular concept, or how important information was, or how important data was. And now we feel we're in the era where trust has to be called out as something that is an organizational value, an organizational effort. So with that in mind, you need a trust framework. And when asked, how do I look at a trust framework or a trust assessment framework? Trust digital trust is considered to be an embodiment of all the ongoing activities in areas of security and privacy and data management, data governance, that manifest itself as some way that parties who may or may not know or like each other can agree upon trusting each other. That represents generally a combination of things that we're already familiar with, like ISO standards, or GDPR, or in health, in financial services, GLBA, and other financial securities acts that combine together lay out some way that organizations can attest or be certified to saying, I'm following security standards, I have security in place, I'm following privacy standards, there's right to privacy by the users, there's a right to protect their data and a right to be forgotten. All of that serving as a framework to be able to say, can I now trust that the rules in this organization, conjunction with the rules in that organization, will allow me to use this credential as a model to identify myself and say, despite the fact that you may not know everything about me, we both agree that we're following these rules together, and you can trust that I can do this, or more importantly, that I can trust you, that you can have my information, or that we can have some sort of transaction or relationship together. Which I think, when you think about it, is kind of the heart of where blockchain and Bitcoin and everything started, which is, even in anonymous, almost adversarial relationships, you could have rules for how transactions took place so that two people could conduct a financial transaction without ever knowing each other, and everyone agreed to what that was. And that was, in fact, really a trust assurance framework. It was engineered into the Bitcoin code and the way in which Bitcoin operates, and that kind of serves as a foundation to then extend that to verifiable credentials, and saying, I present a credential that comes from someone you trust, or an organization that's trusted, and that serves as the basis for our transaction together without having to collect and store a bunch of other information about.
Yeah, I remember in the some years ago when blockchain was supposed to be used for everything, and so in the early days of doing kind of decentralized identity management, a lot of the thinking was, hey, let's just throw everything on chain, and I think we realized pretty quickly that that doesn't that definitely does not hold up. You can't put personal information on chain. So I'm definitely happy with the evolution that we've seen with just off-chain secure communication with verifiable credentials and using pretty cool cryptography and protocols to allow that to happen. But then does the Lumedic, so I guess the Lumedic ecosystem publish its own trust framework, and does it use a specific blockchain as a utility to write information pertinent to issuers and certain credential information?
Yes, and first of all, let me say, I think your summary was beautiful. As someone that's been in blockchain and healthcare for about 4 years, I kind of translate it from a Dilbert cartoon, which is, blockchain is like radioactivity. You can use it for good or evil, and you don't want to get any of it on you. It is something that I believe a lot of people had vision about, well, just use blockchain like Bitcoin and somehow it's all anonymous, when in fact, blockchain does a beautiful job being able to eliminate anonymity and be able to trust or trace and associate transactions with a specific person with a specific information. But when you abstract it out between on-chain and off-chain, just like you're suggesting, then you have a new way to be able to enforce privacy, especially with the principles of decentralized identifiers. We are built on the combination of the Hyperledger Indy Aries framework and part of the Sovereign network. And so you have those principles and trust framework associated with Sovereign and SSI as part of the framework for the Hyperledger Indy Aries network that we're using, or software components that we're using. And to your question, yeah, the Lumedic Exchange is developing their own trust framework and own credential rules, which we intend to publish as they're developed by the working groups to our LumedicExchange.org website to be available as examples for anyone. We see really the most important thing first is culturalization, education, and adoption. That we won't necessarily be the only solution for this, though we'd obviously like to help all the patients in America. But really understanding it and moving it forward as a concept for how patient information should be managed is probably the most important thing, first and foremost. And so we'll share all of the trust framework and governance framework documentation we develop out of the exchange publicly. to do just that, and allow people to build upon it. And when the next thing comes along, whether it's Carry or Hedera Hashgraph or the next version of Hyperledger India or Aries, that we have a framework to help support that.
Yeah, that's awesome. And I love to, just like the rest of the community, like it's great to see you guys participate. And I know you're passionate about participating in different organizations, whether it's the Trust Over IP, ID 2020, or other ones. It's funny going back to that nice illustration that Mike Nash had put together that starts at the paper era. Well, it's definitely not the elimination of the paper era, as we're talking more and more about today, right? It's like you need to be, this technology needs to be accessible to people, and it needs to fit the different cultures or the different ways of using it.
Absolutely. And that drives me, your commentary drives me to another point too, which is this idea of patient-centric and patient empowerment and consumerism. And I know that's on Mike's graphic as well, that we have to take into account the gradual but steady building of consumerism in healthcare in a way that hasn't existed before. And by virtue of making this technology accessible, how consumers can take advantage of it as part of doing their business of daily life. The use of faxes and the uses of paper records have still continued to persist. And nothing makes me want to stick a pencil in my eye faster than when I see an advertisement for a secure cloud-based fax platform. I'm like, well, fantastic. What a great job paging over the cart path, and I'm going to go buy another horse. It's not advancing where technology can go to help consumers and empower patients. And there's a great deal of that effort going on within HL7, of course, too, which is why I'm excited to make it a complementary effort where so many folks around the US and around the globe are working HL7 to advance more effective ways to exchange health information. And we advance, other standards from the global community around identity to be able to make it a patient-centric way of managing that. And it's nothing short of revolutionary. And revolutionary means that there's winners and losers. And you hope that the most important winner, of course, is the patient.
Yeah, with the understanding, like you said perfectly, that there's not going to be one winner. You need to be able to play within the ecosystem and add the value that you're good at adding value in the ecosystem, and can't just replicate the siloed models that are there today. That's not the evolution or revolution that we're looking for in here. And I'll just say I'll post Mike's illustration in the show notes for this podcast. We've referred to it a couple of times. I think it's a great overview of the different eras within healthcare. So within the Lumedic Exchange, I guess there's different organizations that are part of this. There's different working groups that are happening. What's being worked on?
And let me highlight probably my most exciting working group, which is health equity. We've set out to try and get about 7 working groups up and running. We have an identity working group, which are looking at things like identity attributes and binding, things I'm sure you're familiar with that are fundamental block and tackling for how verifiable credentials work. We have another one around registration and eligibility, which starts to tie in the actual workflow of a patient registration process at a healthcare system into the use of a verifiable credential. We're also looking at some very specific healthcare ones for things like skilled nursing facility and for imaging and pharmacy applications. But in our health equity and population health working group, I kind of got excited about it because I spent a lot of time in another concept called social determinants of health, or SDOH, which in healthcare has a lot of conversation going on. And this is looking at non-clinical factors that make up your healthcare healthcare aspects and your lifestyle. And as someone said, social determinants of health are health factors no matter what. We tend to look at them for things like housing security and economic security, food security, but they're social factors that weigh in for whoever is being considered as part of the clinical analysis. It's just it's not information that your doctor historically has gathered that you typically see in a clinical record, but we understand more and more as being a critical consideration. If you live in an area where it's challenging to get affordable housing, that's going to factor into impacts to clinical care and your ability to get to the doctor and just have a place to live. That translates into points of digital information about you that are separate than just what you have in your healthcare record, but have to be considered. And where should they be considered better than in a platform that you control for where that information is available and then shared with your healthcare provider. And then conversely, there are things about your healthcare information that may need to be taken into account when you're being provided housing or for mental health or for food security. But that doesn't mean that you're giving consent to everyone that you meet to just have total access to your healthcare record. And so as there's all of these various factors and determinants that are looked at for modern healthcare, those are sources of digital information that really only the individual concerned can control. And so we're looking at how do these factors of health equity and social determinants of health get considered from a verifiable credential standpoint? How do I tie together some of the work being done in HL7 and things like the Gravity Project for social determinants of health into the identity model that we have in using a verifiable credential? And then probably most importantly, how do we ensure that using verifiable credentials either doesn't create a problem for digital health equity, the so-called digital divide, but in some way maybe even helps mitigate or improve health equity problems that we're seeing in digital health right now?
Are these layers that one would see if they're using a wallet or something, that there would be an agent in your wallet, like your Lumedic Connect, that is able to kind of process this the right way? So you kind of I've seen it differently in different use cases where we start talking less about credentials, but more about kind of capabilities and skills. And so you kind of have this translation layer. Is that something that would be similar with the health equity stuff?
Absolutely. That's a wonderful observation, because for us, this effort doesn't stop with just a credential. The patient era is about patient empowerment. And I mentioned before about AI and other tools you can use. I think that there's nothing more important than continued advancement of that presentation layer, of that user experience, where so much of this is kind of just under the covers. I joke around in the blockchain and healthcare community to say the first rule of blockchain is stop talking about blockchain. What you're really talking about is, what is it in the decentralized application that improves things? And we have to have applications that, an elderly Medicare recipient can understand to use as easily as a 25-year-old millennial JavaScript developer. And specifically in the world of healthcare, what are there about healthcare terms and diagnosis and treatment plans that are not only easy to understand, but can translate into things from a user experience or an engagement platform that work with the patient to keep them informed, to help them make decisions, and at the same time help safeguard their data and the ability to share data and provide consent.
Are there new revenue opportunities too? Like, are these conversations that come up with different people within the ecosystem that are looking to understand, hey, is there, with any proper ecosystem or collaborative model, and you kind of mentioned you got to talk about the value or the benefits rather than just saying blockchain or just talking about the technology, but been seeing this for a while now, where it's like this is great, but as kind of once I establish myself, let's say I'm a healthcare provider, or let's say I'm an insurance company, let's say I'm a lab, these are all participants that would fit within the Lumedic Exchange. Do you work with them to define kind of what the revenue models are? Are there concerns about, like, hey, what if my credentials are reusable and shareable and stuff like that? Do I potentially lose on future revenue? Is this stuff that you guys talk about?
I can't say that we've had some of those specific conversations, but I think some of what you're alluding to is really important, which is, just the general concern overall that so many healthcare applications are just another form of surveillance capitalism. And that saying, hey, what a great application to help you manage your healthcare, only to find out that you're putting all of your personal data in it and they're doing something with it behind the scenes. So that's clearly not something we want to have as a problem. And I think just in general, as you mentioned, the concept of verifiable credentials and using your patient identity, being cognizant of ways that you don't inadvertently create that surveillance capitalism, or find new ways to construe information that becomes restrictive. Nobody wants to be able to have their healthcare data present a situation for an insurance company to pass judgment on not covering them or to raise their rates. So is there ways that healthcare information is anonymous around decision making or anonymized, that allow you to protect your identity, limit bias or unethical approaches, and at the same time advance how that information is used for effective, quality measures and quality metrics?
Mhm. That's interesting. There's something strong about having selective disclosure, but also beyond that, just being able to control your image or your persona and not needing to necessarily divulge all the information about yourself, so you're not like completely exposing yourself to everyone and to everywhere, and basically along the surveillance capitalism lines that you just said there. But in order to, I guess, as a patient, if I'm now using Lumedic Connect, I have some credentials on there. I'm able to use different services and stuff like that you'll have on there. But this is something that when I show up to a doctor's office or something, and they're still using their traditional systems in there, whether it's an EHR or whatever it is the idea at that point. And I think one of the working groups you talked about kind of might be covering a lot of this stuff, but is that how it works? I show up at my doctor's office, I scan a QR code, and I give them consent and I transfer certain data to their system?
Yeah, and that is the long-term vision for sure. And you're right; those are areas that our working groups are still sorting through to understand the specific mechanics. It is approached with the idea that you would have, basically a QR code presented and a QR code reader as the fundamental kind of interface point for everyone to consider. It could be near field communications, NFC or Bluetooth as we build upon it. But just that initial point of registration and leveraging that QR code is where our conversations are starting. That is correct.
Got it. And I saw something posted that I think there's trials, or it's being tested internally, right, within kind of the Providence system, where there's actually like this is being piloted, it's being tested, it's being used as we speak.
Yeah, so it's being piloted and tested around the vaccination credential first, because that's obviously the use case. The other one's in development. And I would just mention that, again, the opportunity that we're afforded with Providence Health Systems is a landscape of 85 million patients and 120,000 caregivers. So we have a very broad and diverse landscape in healthcare to be able to leverage, quote unquote, kind of in our own backyard, which just will help, demonstrate efficacy for healthcare overall. It's not just, a single clinic in one single town someplace, which, makes it very exciting to show the depth of development that's possible.
Awesome. The other projects I've seen in the healthcare space, I think, have been more from the doctor or the physician side of things, right? Like I know you collaborate with NHS, and I've heard conversations with them on before. Is there collaboration with them too, although they're kind of touching the other side? I guess within the larger ecosystem, everyone needs to be plugged in.
Yeah, that's a great question. We don't actually collaborate with NHS in the UK at the moment. I've had the pleasure to certainly some colleagues there and talk with them a bit, but our focus is in the US, and the US is just so large and so diverse in terms of what we're trying to address that I'd welcome the chance to work with the NHS in the future, but we want to conquer US healthcare first.
Yeah, makes sense. So just in closing, Jim, what's on the roadmap? What should people expect from Lumedic for the rest of 2021, and how could people help out?
Sure. So a couple key points is just our work with the Good Health Pass Collaborative, as well as internally with Lumedic, to continue to advance what a secure, privacy-preserving sort of vaccination credential is like, if in fact people are called upon to need it for travel and return to work and the like. building upon that to help improve and really revolutionize the registration workflow, which potentially not only saves patients a whole bunch of time and preserves their privacy, can be tremendously efficient on the part of the healthcare systems too. And then just continued growth and participation in the Lumedic Exchange to define new use cases, new proofs of concept, and being able to advance this verifiable credential patient information platform concept that much further in 2021 and into 2022.
I love the vision towards the patient era. I think you guys are at the forefront. I look very forward to keeping a close eye on what's happening and the progress that's going to be happening this year and over the next few years. Jim, thank you very much for doing this with me today.
Thank you, Matthew. It's been a pleasure, and I look forward to you keeping me honest in our development.
Thank you for listening. Hope you enjoyed the conversation as much as I did. To stay up to speed with future episode releases, please subscribe to the podcast on whatever channel you're listening to it right now. If you have any questions or comments, please reach out to me directly. You can find me online. I'm quite active on LinkedIn and Twitter, so I look forward to hearing from you. See you all next time.